The member from London West.
Thank you, Speaker. My question is to the Premier. Speaker, I have been raising concerns about London's mental health crisis since I was first elected, but over those past 3.5 years, all this Liberal government has done is make things worse. 2 months ago, I shared the story of a constituent forced to lie for a week in a hospital hallway waiting for a mental health bed. Last week, another constituent, David Warren, spent more than 3 days in the ER waiting for his wife to be transferred to the mental health unit after she had been ordered to go to the hospital through a Form 1. Eventually, she had to go to St. Thomas to get the treatment she required. Does the Premier think it is acceptable that Londoners have to leave their community to access the emergency care they so urgently need?
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker. And we continue to make investments in mental health and addiction services across this province, including in London. And it was this government just a couple of years ago that provided the more than $1 million in funding for the operations of the Crisis Centre, which provides a critically important, as the member well knows, a critically important resource for individuals in London who are facing those mental health challenges, Mr. Speaker. But we've also fairly substantially, I would say, increased the budget of London Health Sciences itself, $16 million more to their operating budget this year, in addition to the funds that were provided to them last year, which enables them to deal with some of those challenges that they're facing, whether that's in the ER, whether it's bed capacity, Mr. Speaker. But we're working on all fronts.
Answer.
We're working with the hospital, we're working with the crisis centre, we're working with the community to find other measures that can be taken to provide that high-quality care.
Yep.
And supplementary.
Again to the Premier. Speaker, when my office spoke to the London Health Sciences Centre about David Warren and his wife, staff at the hospital acknowledged that long waits in the ER only worsened the condition of mental health patients. They said that the system had failed David's wife. One of the things that could help is London's proposed mental health diversion project, which could divert as many as 3,000 people a year from the hospital ED to the community-based crisis centre. 5 times I have asked this government to approve this pilot project, but the project remains stalled. In fact, London Middlesex Chief Neil Roberts, who is here today, has become so frustrated that he has temporarily withdrawn EMS participation from the project. Does the Premier agree that her government is failing families like David's, and will she commit to implementing London's much-needed mental health pilot project now?
Thank you.
Be seated, please. Be seated, please. Minister.
Well, and of course, I acknowledged Neil at the beginning of question period, and I'm glad that he is here with us on this issue. And Neil himself and other paramedics and EMS providers, they understand the law in the province, where they are required to, if they receive an individual, whether it's mental health or physical health situation, they're required by law to deliver that individual to a hospital environment. There was a solution that was suggested to the crisis centre where they could strengthen the relationship between the hospital and the crisis centre run by CMHA that would have permitted almost overnight, Mr. Speaker, for that solution that the member opposite is looking for to happen. However, notwithstanding their rejection of that solution, which exists in Ottawa and in Sudbury and works quite well, Mr. Speaker, we are working on what I believe is quite an innovative solution. We're working with all partners, EMS, the London Health Sciences, CMHA. I wish we were working with the member opposite. I know she's raised this 6 times. I am prepared to work with her if she'll work with me.
Thank you.